As a patient, have you ever heard of the 4 phases to recovery? Well, you might not have heard of them, but you've probably been through them if you went to conventional physical therapy, chiropractic, massage, because these are the phases that they believe that you as a patient need to go through in order to return to whatever it is you want to do. Stay to the end of this video because I'm going to expose one of physical therapy's biggest dirty little secrets, and you're going to understand why these phases actually don't exist. So let's break them down. So phase number 1, according to the conventional medical model, is the pain phase. So this phase lasts approximately 2 to 3 weeks. So this is where you go as a patient to physical therapy, and they do things like electrical stimulation or ultrasound or ice or heat or maybe cupping or needling to get your pain to decrease. So the whole point of this phase is to keep you coming back because you felt better when you left than you arrived. So once again, this is only focusing on pain. We're not talking about getting to the root cause. We're not talking about function. We're just trying to get you to be happy when you leave, even though when you come back, you probably have the same symptoms again, and then they're going to address those same symptoms with the same symptom modification things. This, once again, is going to take 2 to 3 weeks. The next phase is going to be the motion phase. So this is when your pain has calmed down, and now they're going to try to establish better range of motion. And this phase is going to take 2 to 3 weeks. So after 2 weeks of getting the pain to calm down, we get pain to calm down enough to start working on restoring range of motion. So if you're a shoulder patient, pain feels better in the shoulder. Now we're going to work on getting you to move the shoulder through bigger ranges of motion for the next 2 to 3 weeks. After the motion phase is going to be the strength phase. And guess what? This is going to take 2 to 3 weeks. Now, keep in mind, you're going to physical therapy here somewhere between 2 and 3 times a week. So 2 to 3 times a week for 2 to 3 weeks, 2 to 3 times a week, or 2 to 3 times a week for 2 to 3 weeks, and then 2 to 3 times a week for 2 to 3 weeks. Here, now that we have the pain calmed down enough to do motion and we have better motion, now we're going to work on strengthening through that range of motion. So we're going to start giving patients exercises to do in the clinic or at home. And if this increases your range of motion, or this increases your pain, guess what? We're back to the pain phase where we start doing these things again. So the last phase, as you get through these and nothing flares up, the last phase is going to be return to play if you're an athlete, or return to your normal activities of daily living if you are a non-athlete. So now we're going to start working on things if you're an athlete, like running, jumping, cutting, maybe throwing, things like that. If you're a work comp patient, we're going to work on things that look like what you do at your job so you can return to work. So once again, 2 to 3 weeks. So if we look at this and we add this up, you're going to be going to physical therapy somewhere between 8 to 12 weeks. And that's 2 to 3 times a week for 8 to 12 weeks in order to get to return to play so you can go do what you're supposed to be able to do. Now, here's the dirty little secret. Shh, don't let your physical therapist let you know that, don't let your physical therapist you know this. So if you take the run-of-the-mill low back pain patient, bends over, throws out their back, lifting up something heavy, if that patient, according to research and studies, if that patient does nothing, doesn't go see a doctor, doesn't go see a physical therapist, doesn't go see a chiropractor, doesn't get a massage, they just chill out at home for 6 weeks, their pain will go away and they will go back to doing whatever they want to do. So what physical therapy knows is if they can keep you coming in for at least 6 weeks, you'll start to get better whether they do anything that's helping you or not. So correct, you figured it out. You can stay at home for 6 weeks. If you're totally fine with not doing your normal ADL or your normal sports for 6 weeks, save your time and money. Don't go through these phases because I'm going to tell you in a second why they don't exist. Stay at home, hang out for 6 weeks, you'll be better. Now, the root cause of what happened won't be gone, so you'll feel better after 6 weeks. You'll go back to doing whatever it is you're doing. You'll bend over to pick something up again, and boom, your pain is back and you're back to sitting at home for 6 weeks waiting for it to go away. So that's why physical therapy has you come in so much for so long of a time. If you're seeing your typical cash pay PT, they're selling you a package of visits and they're telling you that you have to go through these phases because they're trying to stretch out your visits as long as they possibly can because that's how they make more money. So let's go through what really is going on here and why you don't need to do this and what we would do differently if you were a patient at 180. So we understand that pain is not the problem. So we're not going to waste your time and your money treating your pain because treating pain doesn't solve the problem. And we want to be problem solvers, not pain manipulators. So we're not going to worry about your pain. And we just saved you 2 to 3 weeks. What about your motion? Well, we understand that motion, lack of motion, or pain with motion is due to neuromuscular dysfunction. So if we focus on motion, we might be able to get your motion better for a short term of time, but then you have to come back to get that motion back again. So you're yo-yoing back and forth, and that's why you're going in for 2 to 3 weeks. So we're not going to worry about motion either. Strength. Lifting weights, does that solve your problem? No. If that solved your problem, then people who lifted weights would never get hurt in the first place. So giving you strengthening exercises to do is not going to, once again, get to the root cause. Treating pain doesn't get to the root cause. Treating lack of motion doesn't get to the root cause. Making you stronger or trying to strengthen you does not get to the root cause again. So once again, we're not going to do that. Oh, and by the way, as we are not doing these, you're not coming in for 2 to 3 times a week, and you're not coming in for 2 to 3 weeks. Pretty simple, right? So we're going to get to return to play in 1 to 3 visits, not weeks. And you can forget about 8 to 12 weeks, 2 to 3 times a week. So we might see you 4 visits over 4 weeks. And you've already got back to play. So our goal is to eliminate all of these issues, get you back to what you want to do by getting to the root cause. We get to the root cause by A, watching you move, figuring out what your specific problem is. So we're not worried about giving you a diagnosis because a diagnosis doesn't tell us what the root cause of your problem is. We're going to get to the root cause by watching you move, putting you on the table, breaking you down, and getting to how well you function on a neuromuscular level or how well your nerves communicate with your muscles to give you full range of motion, normal strength, which eliminates pain. All one step, all the very first visit. So after the first visit, we're probably going to tell you, go back to what you do at some level. Go back and throw a little bit, go back and run a little bit, go back and walk a little bit. And then when you come back for your second visit and you say, yeah, that felt pretty good. Now we're gonna say, okay, do more. I'm going to give you more exercises that are specific to what your problem is, rather than putting you in these phases, which is cookie cutter, that everybody gets the same handout. We don't give exercise handouts here because we have to custom make your exercises every time you come in. So this is how we skip this, and this is how we ignore physical therapy's dirty little secret that if you do nothing for 6 weeks, you'll be better, at least feeling better, even though you're not functioning better. We want to get you to feel better, so no pain, full active range of motion, normal strength, back to your normal ADL or back to play after at least 1 to 3 visits. So if you're ready to do this and save time and save hundreds of dollars, maybe even thousands of dollars, by coming here and being a patient at 180, let us know if you've never been a patient here before. The best way to experience how we skip all of this and get you better in 1 to 3 visits is to call and ask for a free consultation, and we will actually demo on you what we are doing so you understand why what you did in the past didn't work.